The CSWB approach evolved from 1980s crime prevention methods in England to a more integrated framework. This change recognizes that community safety requires more than just policing. It demands multi-sector collaboration addressing social determinants of health and safety. This shift is evident in both the UK and Canada, where partnerships were formed to tackle issues beyond crime, including health, welfare, and community development. The approach gained traction in the US and Canada, addressing broader social and economic conditions rather than just focusing on law enforcement. The term community safety and well-being became prominent, with initiatives like the Hub model in Saskatchewan and Ontario shaping the approach through multi-sector collaboration. Multi-agency partnerships between public, private, and voluntary sectors focus on community-based measures against crime and antisocial behavior. In the U.S., public health approach emphasizes violence prevention and crime reduction through multi-sector collaboration. Initiatives like the Paramore Kid Zone in Florida integrate education, healthcare, and family support to reduce juvenile crime and other issues. Prevention Institute highlights a public health approach to community safety, focusing on systemic inequities and community-led safety strategies. Australia. Government and community collaborations emphasize a holistic approach to reducing risks and vulnerabilities. UK. The What Works Wellbeing Centre promotes inclusive, participatory approaches to community safety. Canada. Ontario's CSWB planning framework guides local planning with cross-sector collaboration to address risks proactively. The roots of the community safety and well-being approach lie in multi-sectoral collaboration and systemic change efforts that began in the late 1980s in England and expanded to North America in the following decades. The CSWB concept has been applied internationally with different focuses and has evolved into a framework that includes risk mitigation, multi-sector coordination, and systemic solution building to enhance community well-being and safety. The Brookings Institution proposes expanding community safety through public health strategies, such as increasing resources for low-income schools and creating new grant programs for youth-focused community centers and programs. This approach has been applied in initiatives like the Clean and Green program in Flint, Michigan, which demonstrated a reduction in violent crimes by engaging community members in maintaining neighborhood spaces. These studies and frameworks reflect the evolution of the CSWB concept from a narrow crime prevention focus to a broader, multi-sector approach that encompasses various aspects of community well-being, such as education, health, equity, and social justice. The strategies emphasize community-led initiatives and intersectoral partnerships, showing promising results internationally in creating safer, more cohesive communities.